we had a dentist. He actually runs his own practice. He came to one of our dinner seminars several years ago, and still working. His wife works with him. She's a staff member at the practice. Small group. There's like 5 employees, I think, maybe at the most. And she's significantly older. She's already about 4 or 5 years past 65 at that time. And came up to me afterwards because it talked about creditable coverage, not creditable coverage, the differences between them, and what can happen if you don't have it. So they came up to me afterwards and asked me, like, I think we need to talk to you because, I have a small practice. It's my own health insurance, blah, 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 blah. I went through that with him, and he goes, but I simply tell him, well, yeah, you don't have creditable coverage. So that means if she were to enroll at this point, she's going to be dealing with a penalty for the 4 or 5 years that she's gone without it so far. And fast forward, they did nothing. They didn't take any action on it. They didn't take any action on it because they didn't feel like it was necessary. They didn't feel like it was a real thing that could happen. A couple of years go by, they come back into the office. They come into our office as a walk-in with more questions because now he's getting ready to sell his practice. He's getting up there too, and I think he's actually missed his Medicare enrollment as well. But the same situation. Some people they don't want to. They don't want to accept it. But that's the reality that they are in, and it was all because he was under the impression that he had health coverage through his company, and it was providing health benefits for all of his employees. So he had the assumption that many people do, just because I have health insurance means I don't need to do anything from a Medicare. But it's not the case, and they're paying for it now.
In his lifetime. It's a lifetime penalty. It's a mistake that could have been avoided. It's a mistake that should have been avoided had they listened, because that's the interesting thing here. This is somebody who's a professional. Yep. This is a doctor.
Mm-hmm.
Again, and I know we've talked to people that have gone to doctors and asked them, what should I do with my Medicare? Yep. This is a doctor that himself made a mistake for him and his spouse and ends up paying lifetime penalty for it.